from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
Well, doctors say that you should be a little more worried about the flu than catching Ebola. While medical experts say Ebola has killed more than 4,000 people worldwide, influenza kills tens of thousands of people in the U.S. every year. Dr. Meredith Maxwell joins us now from Toro with important information as we head into flu season. Good morning to you.
Good morning.
Thanks for coming by, doctor. And you know, Ebola gets a lot of the headlines, but still, the flu, pretty dangerous. What can we do to protect ourselves?
Definitely. Prevention is key. Realizing those at risk, washing your hands, don't touch your face if you can help it, stay home if you have a fever. Your symptoms can start from the day before you actually have symptoms. You can be contagious the day before till about 5 days after. So, you know, if you think you're sick, maybe call your doctor. Pursue treatment early, that kind of thing.
Yeah, get into the doctor and make sure that you don't have the flu before you might start infecting other people. Talk about the flu vaccine, though. A couple options for people to get a shot or even, nasally?
Well, it depends on your age and what your doctor has available. So, children and elderly might get something different. If you're allergic to eggs, something different might be available for you. So, the flu option is not, unavailable to you if you do have that contraindication.
Yeah, and sometimes people get nervous about the flu vaccine, but what can you tell people for those who might be a little uneasy about it?
Well, first of all, I tell my patients, don't listen to Grandpa Joe or Grandma Mary about the flu shot. Please talk to your medical provider to get the correct information. It really can reduce symptoms, reduce missed work hours, reduce school absences, reduce symptoms. Although it's not 100% effective every single year, it's about 60 to 70% effective. And it really is important, especially for those people at risk, elderly or young children, people with complicated diseases, chronic diseases.
What are some things that people should be looking out for in particular when it comes to the flu? Because a lot of times it seems as though the flu and the cold kind of mask each other's symptoms a little bit.
Well, fever, headaches, body aches, congestion, those kinds of symptoms kind of give you a clue to if you have flu-like symptoms. And then always call your doctor, and maybe they can steer you in a direction, cold versus flu symptoms. So, if you have an inkling, the sooner you pursue treatment, the better your outcome probably will be.
Give us an idea of just how dangerous the flu is if left untreated.
You can have lots of complications like pneumonia. You can have a bacterial sinusitis, even hospitalizations for those at risk. It can be deadly in certain situations. So, I know Ebola is on the forefront, but don't forget about the flu.
Yeah, and certain just basic preventative measures that people can take, especially when flu season kind of comes around. We're talking hand washing and pretty much the standard stuff.
I mean, after you shake somebody's hand, maybe think about washing. If you sneeze into a tissue, throw that tissue away. It's really hard to do, but avoid touching your face, your mouth, if you can. And also, please don't go in if you suspect you have the flu, because you're going to infect other people.
Right, and I have a couple of kids, and so whenever we're heading out this time of year, you always keep that hand sanitizer with you.
Right.
Because they're always touching all sorts of stuff. But Dr. Meredith Maxwell, thank you so much for joining us this morning. We appreciate that advice.